Good morning, everybody. It's difficult to come to the podium to appear before you to discuss the situation that we find ourselves in related to COVID-19 on any given week over the last 9 months. We've been dealing with this, and this morning is really no exception to that. Our Board of Supervisors and both Mr. Constantine and I find ourselves in the extremely difficult position of trying to lead our community through this extraordinary time we're in. And of course, this is why we're here, and it is a privilege, it's our privilege. But navigating through this epic mess that our country and our state finds itself in is a very difficult and daunting task. Both Mr. Constantine and I understand that any given week, when we are here speaking before you on these matters, our words, what we say, matters. We also realize that no matter what we say, there are those of you who will take issue and will disagree, and there are those that will embrace and agree. And even that seems to change on any given week, depending on the situation. With that said, I want to thank the residents of Kern County and our community for the very hard work they're putting into this effort, all that they're doing at home and outside their home to make sure that they are helping manage and control the spread of the virus, everything they're doing to ensure the safety of themselves, their families, and their friends. Our community is doing a good job. I want to thank our business community for the past 9 months who have been whipsawed by varying rules and procedures and directives, who are struggling. I want to thank our business community for the effort that they're putting in to comply, to make sure that whether they're a retail business or a restaurant or anybody in between, making sure that their employees and their patrons are safe so that the spread of the virus is extremely limited. And just thank you very much for all the work and effort that you're putting in under very difficult circumstances. I want to thank our schools, the administrations at these schools, our teachers, for everything that you have done and everything that you will continue to do to have our children back in the classroom safely and responsibly. Your work right now is the most important work being done in our community, if you ask me. Thank you to our healthcare community, obviously our hospitals, our hospital administrators, our nurses, our doctors, for all of your continued work over these past 9 months. Thank you to those people showing up, essential workers, first responders, certainly our own county staff showing up, continuing to do work on a daily basis under very, very difficult circumstances. This week, given increasing rates of infection all over the United States, we find ourselves, along with about 95% of the state's population, our own state's population, having to deal with increased restrictions on how we live and on our own local economic activity. We're all tired. We're all over having to deal with this hell of a mess that we're in. We are, in short, socially, emotionally, and financially overwhelmed, spent. Many of you, particularly our business community, are frustrated with the changing directives and orders of our state's governor, which are affecting your lives and your economy, your livelihoods. To be fair to the governor leading the state through this time, doing all you can to manage through this and manage the spread of this virus is a very tall order, particularly when there is no instruction manual for it, and with the future of the virus being uncertain. However, this frustration that you feel is real, and we understand it. You have every right to feel that the way that you do. And those of you who are at your end, you have every right to voice your dissatisfaction with the way things are being handled. It certainly does not help and only adds to your frustration and overall confusion when you see reports that the very state officials demanding and in fact ordering rigorous adherence to state-issued directives may not be adhering to those same directives and orders themselves. It also doesn't help when you go on TV or you go on the internet and you read 35 or 40 different stories or reports about COVID-19, and they all conflict with one another on data and facts and outcomes and suggestions, etc. This only adds to our confusion and the problems that we all have in dealing with this. Folks, this virus is here in our community. It continues to spread. It will continue to spread rapidly until an overwhelming majority of us contract it and/or we have a viable, effective, and safe vaccination made widely available. Staying vigilant, washing your hands, not touching your nose, eyes, or mouth every minute, staying away from others when you're sick, regularly cleaning frequently touched surfaces, distancing, wearing a mask when you're in large, unfamiliar, particularly unfamiliar groups of people, when you can't distance, and yes, keeping yourself and your family members in overall good health with a good diet, good sleep, good exercise. All of those things are time-tested standards in achieving good health and protecting yourself in any time from getting sick. This is the foundational bedrock method that we need to employ in this community to help slow the spread. If you're at an age, or if you have an underlying medical condition or several underlying medical conditions where you're at greatest risk of complications from COVID-19, you should be practicing these things with the utmost rigor, more so than all the rest of us. These are the practices that will slow this thing down. These practices will maintain adequate capacity in our medical institutions, which continues to be Kern County's top priority. These practices buy us time and help us perfect treatment options. These practices will help, at the end of the day, save lives. We can't let up. We can't let our guard down. We need to continue these practices with daily regularity. We thank you for what you've done. We thank you for what you will do. This is very, very important. With that said, our business community, our parents, and their children should not carry the full weight and burden of managing through this pandemic. Our local contact tracing shows no evidence that restaurants, gyms, churches, or schools are contributing to significant spread in our community, nor do we have any evidence that they are the catalyst to the surge in case rates we are experiencing now? Our local data indicates that this virus is being spread with regularity through private social gatherings and in situations where individuals are not practicing or are ignoring altogether the litany of best practice, public health practices that I just discussed. While the vast majority of us in Kern County are doing all we can, it just takes a very small fraction of us to blow it for everyone. In short, it is not the fault of those businesses who are going to great lengths to be safe, who have been following the rules for months and months. It is not the fault of our schools, who on a daily basis now are approaching our students' lives and their well-being safely and responsibly and with vigor. I believe that our restaurants, our gyms, our retail establishments, everyone in between, can operate safely and responsibly, adhering to state-issued public health protocols for very limited and measured indoor operations, just as they have been doing. I believe that it's possible for our places of worship to conduct services indoors in limited capacity, following strict state-issued guidance. Guidance that was specifically issued to assure the threat of transmission of this virus is extremely low. I believe that our children need to be in school as long as those schools are operating under strict public health protocols that ensure the safety of our kids and their teachers. And when the virus is detected, there are protocols in place to immediately and effectively deal with it. These measures can work, and they are working. Our schools are doing an outstanding job. But despite what I might believe as the CAO here, despite what our board members may believe, we have no control over the state or the decisions that they are making. We have no control over which businesses or activities they order shut down or closed or modified. We have no control over any orders, directives, or advisories that they make. The governor, as I've said before, numerous occasions, has tied millions of dollars in funding to counties, he's tied those millions of dollars to our compliance with his orders. And we're required to attest on a pretty regular basis to that compliance. Those businesses that are here locally that don't comply with the governor's recent orders this week may very well be subject to state action in some capacity. It's unclear to me how the state is going to approach this going forward, if differently from before. We, however, will continue to make businesses in our community aware of what the state is requiring of them. And we will do that proactively with rigor on a regular basis going forward. We'll also continue to be sharply focused on the things here locally that Kern County can control. These are things that Mr. Constantine spoke about earlier. These are things like testing, making sure we have ample capacity, making sure we have ample capacity in the areas of our community where it's needed most, making sure we are getting more and more people with each and every day going forward to get tested. We need to double our numbers. Our tracing, our contact tracing, doing a good job there. Economic relief and assistance. We've done a heck of a lot of that over the last 9 months. These are things that we will continue to do. and obviously strong public education. These are things locally that we have the greatest ability to control, but we also can control what we ask of our governor. And this morning, Governor, it's our hope and our request that you carefully consider the decisions that you're making related to COVID and the decisions that are impacting our community and our Kern County businesses and our residents going forward. We've been at this a long time. Please make data-driven decisions. We want to help. We want to support you. We want to be part of the team. We want to slow this thing down. We want to maintain capacity in our hospitals. However, repeatedly targeting our small businesses, whipsawing them with new directives and orders, particularly after they've spent time and money implementing your public health protocols, only drives them further away from complying. And you're losing them, Governor. Not just here in Kern County, but you're losing them all over the state. They are capable. Please, Governor, keep our children in school. They are there now for the most part. There are some kids that are not back yet due to decisions by school boards. But thank you. Thank you for allowing our students to be back in the classroom. But Governor, moving them back home only exacerbates our challenges managing through this. Our children are not learning at the same level from home. Mental health and social welfare are at stake for many of our kids here in Kern County, particularly here in Kern County. Give schools direction, give them guidance, and hold them accountable for meeting the moment. Hold them accountable. Regulate that. They are capable. Lastly, Thanksgiving is next week, and I'm not going to stand here and pretend that we have any control over what any of you do at home on your private property during the holiday. We want you to enjoy your holiday and enjoy Thanksgiving. You should all do that. However, we ask you to consider the fact that this virus is here, it's spreading, transmission is going up, not just here but everywhere. It's real. Those in your family that may be attending these gatherings who are predisposed to potential complications, they're at an age or they've got underlying medical conditions that may complicate things if they come down with this virus, requiring hospitalization, potentially even risking lives at the end of the day. Those people you need to take great care with. Those people that I'm talking about who are considering attending Thanksgiving gatherings, you may not want to go. Folks, we need to stay vigilant. We ask you to simply be smart and stay vigilant, but enjoy your holiday. We thank you very much in advance for everything that you're going to be doing, that we're all going to be doing together going forward through this very difficult time as we move through the holiday and into the end of this horrible year that we're in. And we appreciate you. So with that, we're going to get into questions. Megan Person is not here today, so I will be managing the Q&A. Remember, each news organization that's on the line, I'm going to go through, I'm going to call your organization out. It's in no particular order. You are on mute. To unmute your phone, it's simply *6, I believe. And we will begin the Q&A now with Valley Public Radio.
Hi, thank you, Ryan. I was wondering, so about the motion that the county passed months ago at this point to spend a number of $1 million on bringing on traveling nurses. I was wondering if there's any of that funding left to bring on more, and also what are hospitals in the county, generally doing to sort of prepare for a possible surge?
Yeah, I'm going to answer the first part and ask Matt to answer the second part. But yes, our board, I think, smartly set aside $12 million in CARES Act funding to specifically support hospital capacity, really around staffing. Staffing is a critical function of maintaining bed capacity. In other words, we may have enough empty beds, but not enough staff, and certainly on the acute care side. And so that effort was meant to early on stake out a position in the traveling nurse marketplace early on, so that we were assured that we would have a pipeline of nurses if we needed it, and we wanted to make sure we were ahead of other counties. As you probably read, there have been reports that people are struggling to contract for these kinds of services at this late stage in the game. So we are very happy with the actions we took. We have spent, I think, north of 1.3, 1.4 million so far on staffing. Again, we've set aside 12. So having that money there going forward in the weeks ahead is going to be critical because we know that case transmission and increased case rates does have direct correlation to hospital rates and hospitalizations. So we're very happy that we are prepared. We hope to deal with that on the staffing side. And I'll let Matt talk about some of the other preparations.